Usually it says recording in process. Yeah, it looks like we are recording. So, okay, well, I'll start over again. My name is Lucinda Harbs, and Stephanie is going to be presenting with me today. She's going to be doing a part of the program on some sleep and pain and some sleep hygiene stuff. And I'm going to do a little bit of introduction about sleep, and then I'm going to talk a little bit about some supplements and some dietary things you can do to help improve your sleep. So I have a couple of cute little quotes I found in this program. I don't usually do that, but I found a bunch that were cute. So when you have insomnia, you're never really asleep and you're never really awake, which isn't that true? Mm-hmm. I know I could lay in bed for 3.5 hours like I did this morning thinking, oh, I'm going to go back to sleep, but I wasn't awake and I wasn't asleep. I was like right in between there. So, and then another one here for me, insomnia was something ordinary and it came and went for ordinary reasons. And as we probably have all experienced that we sometimes cannot actually tie down, why is it that I can't sleep? Sometimes we really know well why it is that we can't sleep, but there are other times we're kind of like, don't know what that was about. So, okay, so just a couple of brief points about some causes of insomnia. Obviously, stress is a big one for people. When we're stressed, the adrenals produce cortisol, and cortisol acts like prednisone. If any of you have ever been on prednisone, you know it affects your sleep. You can't sleep very well because cortisol is the fight or flight. It's part of the fight or flight process, and so it causes some stimulation. I'm going to talk a little bit about cortisol toward the end here a little bit more. And I've just listed a couple of examples of some significant life stress. Illness, when people can't breathe or their stomach's upset, obviously that can affect your ability to sleep. Emotional or physical discomfort or pain, and Stephanie's going to talk about physical pain. Environmental factors, like if you've got a street light outside your window and you're not used to having that, sometimes that really can interfere with your sleep, or if there's a baby that's crying in the next room, and so there's lots of reasons why environmental factors can interfere. Some medications that we take can interfere with sleep. I already mentioned prednisone is one. Decongestants are another one. That's we don't recommend taking Sudafed at night because it can really affect your ability to sleep. Some antidepressants, some high blood pressure medicines, and inhalers. If you use a bronchodilator, that can also affect your sleep because that's a heart stimulant and it just stimulates the central nervous system as well. And then interferences in the normal sleep schedule. So things like shift work or jet lag that are going to affect your normal sleep wake, or we call them the circadian rhythm. So probably we all know the symptoms of insomnia. We're sleepy during the day, generally just tired, irritable, problems with concentration or memory. That's why I said, if I lose my train of thought, please have a little grace. I'll get back on track as quick as I can. But yeah, symptoms of insomnia are just going to vary from person to person. So, all right, so Stephanie's going to talk a little bit about sleep and pain.
So I just wanted to talk a little bit about pain and how that affects sleep or vice versa, just because as a PT, we see this so often with people who are shoulder pain post-surgical, or they have back pain or this or that, and how pain affects our sleep. So 1 in 5 Americans live with chronic pain, and majority of these are also reporting that they have reduced sleep quality, and 1/4 of them actually have some sort of chronic pain or chronic sleeping disorder of those 1 in 5. And then so people living with pain may end up with long-term sleep deprivation, which causes the insomnia, the actual diagnosis, which leads to a lot of other issues, things like decreased overall sleep time, frequent wakings, which is actually the most common complaint for people in pain, is just waking frequently through the night. And then it also can lead to actual sleep disorders like obstructive sleep apnea, restless leg syndrome. And so those are just other cycles of disordered sleep that can also affect pain. Medications may also cause side effects. Lucinda mentioned those just a little bit earlier, but even pain medications can cause sleeping side effects. Pain can contribute to anxiety, stress, and depression. They don't necessarily cause one another, but when you're not sleeping, you're stressed, you're anxious, you're depressed, and that cycle continues to perpetuate. So the sleep stages, and I don't think you get into this so much, just really briefly, we have light sleep, shortwave sleep, and REM sleep. And we need a balance of all of those to feel rested. And disruption of that cycle, not getting enough REM sleep, even just too much light sleep or just the frequent wakings, can interfere with the progression of the stages, cause less restful sleep, and next midday tiredness. So that's really important to remember, that we need those cycles in order to have good sleep. How sleep affects pain. So the effects of sleep on pain may actually be stronger than the effects of pain on sleep. Okay, so short sleep, fragmented sleep, and poor sleep quality actually increases your sensitivity to pain. So in that nervous system, if you aren't sleeping very well, or you're waking frequently, or just taking short sleeping versus sleep, you actually have higher sensitivity to pain. Your threshold for activity actually becomes smaller. Less activity can increase your pain. Okay. And then sleep loss can actually cause inflammation in the immune system, which we talked about inflammation last time. So just overall inflammation in your system, more pain. Women are more sensitive than men, and older adults are more sensitive than younger adults or children. And then less sleep equals more fatigue, equals less likely to eat well or exercise. And we'll get into some of the dietary things about sleep later on. But yeah, so, and then long-term sleep, quality sleep, so improving your sleep can actually improve your pain long-term. So I just wanted to get into that just a little bit. Retraining the brain to prioritize sleep is important for reducing chronic pain. And so I wanted to talk a little bit about sleep hygiene. Probably have heard of sleep hygiene a little bit, but basically what sleep hygiene is a set of strategies at bedtime to create a routine and environment that helps you promote quality sleep. So why is it important? It's because it helps with the overall mental and physical health and just general quality of life. And signs of poor sleep hygiene would be having a hard time falling asleep, waking often, daytime sleepiness, lack of consistency in your sleep quality. And so how do we practice good sleep hygiene? So having a really good pre-bed time routine, optimizing your sleep schedule, and creating an environment conducive to relaxation. So I'm just going to go through that just a little bit. So like a sleep schedule, if you can wake up and go to bed the same time every day, even on the weekends, that creates a consistency where your body just wants to wake up or go to sleep at a certain time. So prioritizing sleep. So if you are prioritizing sleep over work, exercise, or even socializing, staying up really late with your friends tends to lead to next day tiredness, things like that, or even like needing to exercise. In some cases, actually sleeping over exercising is more important because you're going to rest your body, your mind, all of that. Gradually make changes to your sleep schedule. If you're going to change like what time you're waking or going to bed, do that in small increments, 30 to 60 minutes versus all at once. Limiting your naps. So the optimal nap time is actually about 10 to 20 minutes. And limit it to the early afternoon when you start to get a little bit more fatigue during the day. That's when we start to see a natural decline in energy. So a quick cat nap, really 20 minutes is about optimal to reset your body. Follow the same nightly routine, putting on your pajamas, brushing your teeth, things like that, kind of following that same process. Your body starts to associate the things that you're doing with sleeping. And then start winding down about 30 minutes before the time you'd like to be in bed for sleep. So you're putting yourself in a calm state with that routine, with soft music, light stretching, reading, relaxation, etc. Start to dim the lights. That actually improves your production of melatonin. And then also reducing your screen time in that same time period before you go to bed, before you start winding down, can decrease your mental stimulation. So the screens increase your mental stimulation. The blue light actually decreases melatonin production. And so limiting screen time to 30 to 60 minutes before bed helps you wind down also and get ready for bed. Focus on relaxation, so meditation, mindfulness, breathing exercises, things like that. And if you haven't fallen asleep in 20 minutes, get up, stretch, read, do something else in low light outside of the bedroom, and come back and come to sleep in about when you feel tired again. And then other things to do would be healthy daily habits to help with your circadian rhythm and sleep, just limiting sleep disruptions would be getting sunlight, being outside, fresh air, things like that. get physically active, no smoking, and reducing your overall alcohol consumption. So it seems like alcohol would actually make you fall asleep better. But in fact, it disrupts your sleep later in the evening and as the liver metabolizes the alcohol. So people who drink alcohol in excess tend to have more sleep issues than those who have low to moderate consumption of alcohol. And it also exacerbates symptoms of sleep apnea. So low amounts would be less than 2 for men, 1 for women. Just that amount routinely decreases your sleep quality by almost 10%. Having moderate consumption of alcohol, 2 for men, 1 for women, decreases your sleep quality, by 24%. And high, which would be greater than 2 for men, 1 for women, decreases your sleep quality by almost 40%. So reducing the risk of sleep disturbances when you do have alcohol, you should stop drinking about 4 hours before bedtime, which seems like when you're, going out for dinner or something, like
the middle of the afternoon. Right?
Yeah, I guess, yeah.
Most people wouldn't do that.
Yes. Cutting down on caffeine in the early afternoon and evening can also help your system start to wind down a little bit. Limiting your eating dinner earlier in the evening also can help with this, the good sleep hygiene. You don't want to have any large meals right before bed. In fact, anything that you eat before bed, you want it to be light snacks versus any sort of heavy food. Just doesn't help you sleep very well. And then restricting your activities in your bed. The only thing your bed should be used for is sleeping and sex. So even if you have a TV in your room, that can really interrupt your sleep quality, getting to sleep and staying asleep by having the light, the noise, and just the activity of watching TV in bed. So, and then lastly, optimize your sleeping environment. Make sure you have a comfortable mattress and pillow. So if you're a back sleeper, you want something a little flatter. If you're a side sleeper, something that has a little bit more support to your head and neck. Quality bedding, cool sleep temperature. Actually, the cooler, about 65 degrees, the better. So if you have a controlled temperature thermometers or a thermostat, actually setting it to reduce at night can improve your sleep quality. Blackout light, so either a curtain that blocks all the light or an eye mask. She had mentioned light and sound as something that could interrupt your sleep. So earplugs if you live next to the train like we do, or an eye mask if your husband comes home after you go to bed, and calming scents. Sometimes things like lavender, things like that can help with calming your brain and your senses a little bit. All right.
I was just going to make mention about the screen time. I have something on my phone that you can get. I have an iPhone and I'm sure you can get it for an Android phone also, but I have set up so that if I just do a 3 press, I don't know if you could see it change the color. Mm-hmm. So I can go from blue light to red light on my phone. So when it gets to evening, I do have it set to dim in the evening. I'll put it over here. I don't know if you guys can see this. It changes from the blue light to the red light. Oh, nice. And so there's a way to set up that shortcut. And don't ask me how. I had to Google how to do it. But you can set that up so that you can put that on your phone. So when you get to the evening, it decreases the chance of having that stimulation from the blue light. You can also get blue light glasses, and they're really inexpensive anymore. They used to be a lot. I think they're $18 or $20. You can get a pair of blue light glasses so that if you're working on a screen in the evening, or even during the daytime, you can put those on and it filters out some of that blue light. So you're going to have less effect on your stimulation of your brain. So what if none of these things help? You've tried all this stuff and you still aren't sleeping very well, or maybe it's not possible. Maybe you have a job where you do have to work different shifts, and so you can't always go to bed at the same time. There are some things that you can do, and she's already talked about these. So I want to just mention a couple things. One is that REM sleep, she talked about, is the deepest part of our sleep cycle. And one of the things that's really important that happens in REM sleep, and if you don't get enough REM sleep, it's really compromised, and that's detoxification in the liver. So phase 1 and phase 2 detoxification in the liver happen during REM sleep. And that it's a really, really important process for getting rid of toxins and drugs and hormone metabolites and just all different things that the body needs to handle and get rid of. And if you don't do that, you're going to end up with it's like blocking the stream. You're going to block everything upstream from it, and you're going to end up with a bigger toxin load than you really need, and could end up causing some long-term complications down the road. So another reason to get, really make sure that you are getting some REM sleep at some point. And the thing I ask people is, do you awaken rested, and do you feel like you sleep well on my intake form? Because if people say, yeah, I'm sleeping from 10 to 6, but I wake up and I don't feel very rested, that's kind of the problem. Something must be interfering with REM sleep. So the other one that I wanted to mention is aspartame, which is an artificial sweetener or NutraSweet. Some people can have an adverse reaction to the sweetener and can affect their sleep. So that's another one. Warm milk, if you tolerate dairy, it has tryptophan in it, which converts to serotonin. So does turkey. So that's why everybody wants a nap after Thanksgiving dinner, right? Because of all the tryptophan. And serotonin is a precursor to melatonin. So it has helped with providing the substrates that we need in order to make adequate melatonin. Reactive hypoglycemia can be a problem for some people if their blood sugars are not regulated well. So, if you're somebody who has those kinds of problems, there are some specific dietary recommendations for reactive hypoglycemia, and then any food sensitivities or food allergies. So if you've got some of these other things I've listed, like migraines, runny nose, eczema, those tend to kind of go along with food allergy or food sensitivities. And so those might be indicators that you've got some food sensitivities going on. So. Okay, so I'm going to talk about some supplements here. Some I'm going to talk about in a little more detail than others. This is my favorite quote in this whole program. My mind is like someone emptied the kitchen junk drawer onto a trampoline. That's what it felt like last night. It's like everything was just coming up. And so, yeah, that's kind of accurately portrays what it feels like sometimes to try to sleep. So magnesium is probably my number one go-to thing for people with sleep issues, because magnesium is a very common deficiency. 80% of us, they estimate, are deficient in magnesium. And so we tend to see a cluster of things. And so if people say they're having trouble sleeping, I often will ask them if they have other things like migraines, constipation, high blood pressure, muscle cramps. There's just this whole list of things that goes along with magnesium deficiency, and sleep is just one of them. And I remember years ago, one person took some magnesium home and came back the very next day and said, oh my gosh, is it possible this could have helped already? I said, well, I don't know. I guess it did if you slept better. So sometimes if we're deficient, it's like water on a wilted flower. It can just really be helpful. So the typical diet in this country does not have enough magnesium. The common food sources are going to be nuts and seeds, legumes, things like wheat germ, those sorts of things. They're not real common foods in this country. So some people find it easier to just take a supplement. Various types of physical and mental stress can lead to depletion or an increased requirement. So if you're under stress, if you're training for a marathon, or you just like to work out, you may really need extra magnesium, or even just mental stress. Stephanie mentioned restless legs, periodic limb movement disorder that can cause pain. Magnesium can sometimes be really helpful. And there's a specific form of magnesium that I use in people that have muscle issues, if that's their primary complaint, called magnesium malate, because the malate is converted to malic acid, which is used as fuel for muscles. So that can be sometimes very helpful. And there really haven't been any studies that I was able to find that look at magnesium specifically for sleep, but I'm telling you, it works like magic sometimes in people. So, and it's a pretty easy thing. We know there's a couple of different ways that it can work. It helps to relax muscle. And we have muscle and blood vessels, so it helps increase blood flow to the brain, blood flow to the liver, the places that we need to have blood flow when we're trying to go to sleep, and relaxes the muscles. It also supports one of the neurotransmitters we call GABA, or gamma aminobutyric acid. And this is a neurotransmitter that inhibits the brain. So we have excitatory and we have inhibitory, and we have to have both. And if you have too many excitatory, not enough inhibitory, you're going to have trouble sleeping. If you have too many inhibitory, not enough excitatory, you're probably going to be snoozing and dragging and just can't get going. And you're going to be the opposite, obviously. So supporting GABA, though, we can calm the mind and helps turn off racing thoughts. And that's one of the keys that I ask when people say they have trouble sleeping is, do you have trouble with a racing mind? Oh, yeah, that can often respond really well to magnesium. One of the great things about it, it's safe for kids. It's one of the few things that I think are safe for kids for sleep. And you can't believe how many kids have sleep issues. It just blows my mind. I've listed here the dosing that I use, 6 to 12 milligrams for every kilogram of body weight. And if you're interested in calculating a dose for yourself, if you take your weight in pounds and divide it by 2.2, that gives you your weight in kilograms. And so then that weight would just be times 6 for kind of the bottom end of your dose, and times 12, or you could double it then to get your upper limit. And you can either do it all at bedtime or divide it into 2 doses. But I'll tell you, if you take too much in 1 dose, you're going to get some loose stools. So if that's the case, you can split it in 2 doses, or just do half the dose at night. Start with that. And then if it doesn't take care of things, you could add the other half the dose in the morning. But there's no reason to go higher than you need. But if you do develop any loose stools, you just got too much. You just need to back down a little bit on your dose. So it isn't particularly helpful to monitor serum magnesium in people, and I'm not going to get into why that is. There's a different test that is helpful to look at magnesium stores. But if someone says, oh, I had my magnesium checked and it was normal, that doesn't necessarily mean you have good magnesium stores. It just means there's plenty in your blood to provide for your heart to keep beating. So in terms of products, I do not recommend using magnesium oxide. It has a very low absorption. It's very dense, so you can get a pill that has lots and lots of magnesium if it's in the oxide form, but very little gets absorbed, less than 4% absorption. So we need it to get into the bloodstream. If you want it for constipation, it might work great because it'll give you some loose stools pretty quick. But we really need it to get into the blood, to get into the brain, to get into the muscles. So I recommend more soluble salts that have more like a 30 to 40% absorption on them. And I've listed here some of the common soluble salts that I would recommend in different situations. And the malate's the one I recommend for the muscle issues. Glycinate tends to be the most gentle. So we use that in children, adults too that have sensitive stomach. Citrate tends to be really good for constipation or GI stuff. The aspartate is just kind of really nothing specific about that one. And the same with the amino acid chelate. There are some other forms that can cross the blood-brain barrier better, like threonate or taurate, but they're also really expensive. So I usually don't use those. So isn't this true? At night, I can't sleep, and in the morning, I can't wake up. What a dilemma, right? So melatonin, this is a very common recommendation for supplements. You can get it over the counter for sleep issues. It's a natural hormone that's produced in the brain in the pineal gland. And it has a role in regulating. We actually just had this conversation at work last night. Does it induce sleep, or does it regulate circadian rhythm? That was a test question the pharmacy students had just recently. And there was a debate. They got it counted wrong. The professor said it was regulate circadian rhythm, but the person who wrote the question said, no, it makes you sleep. Well, it does both. And the thing about your circadian rhythm is that's your sleeping waking cycle. So melatonin, when the sun goes down, there's less light that gets into the eye, hits the back of the eye. That's when melatonin production begins to go up. So if you sit up with a bright light reading a book until 11 o'clock at night, you've really inhibited the release of melatonin in the brain naturally. So you really want to have, as she said, the dim lights. When you go back to turn of the, in the 1900s, early 1900s, when they didn't have electricity, when it was dark, they went to bed, and there was a good reason for that, because you need to go when it begins to darken, just go to bed, because we're starting to make melatonin. So as we get older, we tend to not make as much, and that's why sometimes sleep issues get worse as we get older. You can also use it for jet lag. It's really helpful if you're going across time zones and then coming back. There's a way you can take melatonin to help get shifted over to the new time zone and then coming back. High doses are being used in cancer treatment as an adjunct therapy, not as the single treatment. Heartburn and other conditions. I will tell you that I'm not sure if it's in here, but so I don't forget, I don't recommend anyone with an autoimmune disease using melatonin, because it does have some immune stimulating properties. And anybody with autoimmune disease, we do not want to stimulate their immune system anymore. So this is just a diagram, this next one, that shows that from protein, the stomach acid breaks it down into tryptophan, which is an amino acid, which is converted to 5-hydroxytryptophan, or 5-HTP, which is converted to serotonin, which is a feel-good hormone, and then is converted into melatonin, or feel-good neurotransmitter, sorry, and then converted to melatonin, which is the sleep hormone. So tryptophan also is used to make vitamin B3. So it's kind of an interesting aside. That's why it's really important to get enough protein in your diet. So you've got enough to make neurotransmitters and help with sleep and a number of other things. So So there's two different ways you can take melatonin. You can either take it under your tongue or absorption in the mouth. And with that route, you can use lower doses. I usually say 10-fold lower doses if you can find doses that low. I usually use a 0.5 milligram orally. So sublingually would even be lower than that, because I think that all of people are just overdosing on melatonin. People are taking 10 milligrams, 20 milligrams, 40 milligrams, and that's just more than what you need for sleep. Now, cancer, we do use doses like 20 and 40 milligrams, but not for sleep, because we're trying to mimic the body's natural release of melatonin, not these super physiologic doses. And that's what happens when you use these big high doses, is it's super physiologic. And we don't really know the effects of doing that. So anyway, I recommend, you can probably find a 0.3 easily, or a 1 milligram sublingual, which means you just dissolve it in your mouth. One of the benefits there is it's absorbed really quickly. So you could pop it in your mouth when you get into bed, and within 5 to 10 minutes, you're going to have that melatonin in your bloodstream. With oral doses, it takes longer. So you're going to want to probably take it 30 to 60 minutes before, or read for a little bit or something, while that has a chance to get absorbed into your bloodstream. So most studies have been done with 2 to 3 milligrams at bedtime. Sometimes people will go as high as 10, but I really think you need to use the lowest effective dose, just because we don't really know the long-term effects of high doses of melatonin. So sustained release is an option for people if they have trouble waking up. So I often will use like a sublingual to help people go to sleep, but if they can't stay asleep, we might use a controlled release. So it's going to release slowly instead of all at once. Sometimes I recommend people take a sublingual at bedtime and keep one on their bedside table. And if they wake up in the middle of the night, they could take a second one, as long as it's a low dose. And as long as it's not 4 o'clock and you have to get up at 5. Okay, that wouldn't work very well. But if you wake up at 2 and you get up at 6 or 7, you'd be fine to take another dose probably. Now, if you feel hungover, then obviously you wouldn't want to do that again. But you could also do the sublingual low dose and take a sustained release. There are also products that have both an immediate and a sustained release component. So there's a lot of options there with melatonin. I do not like to use melatonin in children because it inhibits growth hormone secretion. And we don't know what it does to their other hormones. And so I just really warn people about not using it. Also use caution if you have a seizure disorder. And there are some medications that can suppress melatonin, like aspirin, ibuprofen, which is Advil and Motrin, yeah, and beta blockers, which are mostly used now for migraine prevention, anxiety. They came out for blood pressure and heart rate, but they aren't used for that much anymore. So, okay, L-theanine is an amino acid which you can find in green tea and some mushrooms, but green tea is a good food source of L-theanine. It's an amino acid that has some relaxation properties, and this is safe for use in children for short term. Unfortunately, I've only seen it available in capsules, but you could open them up and put the powder on a food, because I don't think it probably has any flavor much. So people don't have morning drowsiness or impaired concentration, and people who have anxiety, I've used this during the daytime. So it really doesn't cause sleepiness. It helps with just relaxation is really what it does. So, so I also listed the dose on this slide here. Other supplements that we can use for sleep, GABA is gamma aminobutyric acid, which is that neurotransmitter I talked about at the beginning. That's an inhibitory neurotransmitter. You can take GABA as a supplement. There's some conflicting information about whether it gets into the brain, but it certainly can cause peripheral relaxation, even if it doesn't cross the blood-brain barrier. So people who have some of these muscle things, restless leg syndrome, periodic limb movement disorder, those sort of things, GABA might be really helpful for them. You can use L-tryptophan or 5-HTP, but there are some cautions. You shouldn't use this if you're taking anything for depression that's a SSRI, selective serotonin reuptake inhibitor. Glycine is another one that's an amino acid that is actually naturally found in bone broth. So like oxtail soup, we don't make oxtail soup anymore, but back in the day, that really helps contribute to sleep. Glycine helps with sleep, and I can't tell you the mechanism off the top of my head, but there is a product out there that I use sometimes called Glymag Z that has glycine and magnesium in it together. So, and then niacinamide is another one. It's a form of the vitamin niacin that can be used. So I mentioned earlier about adrenal function, and it has some effect on sleep. And I wanted to show you here this graph that you can have your saliva cortisol tested. And I've taken mine, looked at mine to see what my profile looks like. And what we want to do is do a diurnal. So we want to see at 4 points during the day what your cortisol is doing. And if you look at this table or this graph, the green line is really what we would expect to be a normal profile for somebody for cortisol. So you can see that it starts going up around 3 in the morning for most folks, peaks around 7 in the morning, because remember I said prednisone stimulates you. It gets you, it's like you can't sleep very well when you're on prednisone. The body's natural production of cortisol is what wakes us up. Okay, that's what kind of gets us going and gets us out of bed. So if you see someone like this one, where there's this black dot that's way down there underneath that yellow line, I'm going to guess this person has a terrible time getting out of bed in the morning because it's way too low. There's just not enough cortisol being produced by the adrenals to get them out of bed. So we do early in the morning when they wake up, we do around lunchtime, we do around supper time, and then again around bedtime. And so what you're seeing here is this person has got still low cortisol around noontime, and then they've got kind of high cortisol in the evening. So I would wonder if these people do shift work, if they're going back and forth, if they're a late night person, they stay up till midnight, 1, 2 o'clock in the morning and sleep late. It's hard to say, but this is not a real healthy profile for somebody in terms of cortisol. And it's just a saliva. So you just spit in a tube 4 times during the day and send it in. And if that's something anybody's interested in, I have those test kits that you can do that. I don't remember how much they cost, but it's not maybe $115 maybe or something to do those. So this next cartoon, 3 out of 4 voices in my head want to sleep and the other wants to know if penguins have knees. That is so true for me. I'm thinking all these things. In fact, this morning when I couldn't sleep, I was like, I kept grabbing my phone. I wonder if this, and I'm looking something up and I put it down. Oh, I wonder if that, and I'm looking something else up and then put my phone down. But, I just need to need to stay awake. But that's kind of what happens. It's like the junk drawer on the trampoline, and brain just goes all sorts of places. So I do want to just touch on herbs briefly here. Keep in mind that herbs are drugs. They have drug interactions, they have side effects, and they can be harmful sometimes, and not that they all are. But if you want to use any herbs, you probably want to check with somebody. I could, that's something I do, is I can look at people's supplement regimen and help you optimize and make sure that there aren't any things you shouldn't be doing because of diseases or other drugs that you take. So we just want to make sure we're checking for drug interactions, and you want to use a high quality product that's standardized. And so again, if you have questions about brands of herbs that are quality, that are standardized, I can help point you that way. So I've listed just a couple here. Chamomile tea is one that people may have heard of, that you can help with anxiety and relaxation. The only problem with drinking chamomile tea at night is then you have to get up and go to the bathroom, right? So then you got to get up anyway. So maybe doing it at dinner and then, not having any more to drink after supper, maybe, I don't know. Passion flower is one that we know affects GABA, and it is safe for short-term use. And the same with kava, short-term use. But we do have some liver toxicities will show up sometimes with kava. And some of these products, I just shudder because sleep products, sometimes you look, they have everything but the kitchen sink in there. They might have magnesium and glycine and lemon balm and passion flower and valerian and just all these things. It's like, oh my gosh, there's just like everything in there. Why don't we start at the bottom and we'll just build on some, we'll start with magnesium and then we can try melatonin, and then we, instead of just going to these shotgun approach where we'll just give you everything that might help and hopefully you can sleep, is not really my approach. But anyway, there's a couple of others here. I won't read through these, and so you can take a look at those. Okay. Any questions from people? Any of you on Zoom, if you have questions, unmute yourself. And
Lucinda,
yes,
this is Sally. I do have a question.
Sure.
In your sleep aids, you didn't mention the ingredient. It's typically what we find in Tylenol PM, but I think it's dihydramine hydrochloride.
Hydramine, yep, that's Benadryl.
Yeah.
Yeah, I
Did
didn't
you
mention
suggest
it.
using
I didn't
it?
mention it because it's a drug and because it has a lot of side effects used long term. There's been tied to cognitive decline, some cognitive insufficiencies, I guess, because it messes with acetylcholine, which is one of the neurotransmitters in the brain, and it's an antihistamine. So it's a cough medicine, it's an allergy medicine, and it's a sleep medicine. It just happens, depends on which thing you're using it for, what the side effects are. If you're using it for an allergy medicine, the side effect is drowsiness. If you're using it for sleep, the side effect is it dries up your nose and your mouth. So, it works for people, but I do caution about using it long-term, and it's certainly not a natural approach. It doesn't do anything to really address the root cause, but thank you for asking. It is very commonly used. The other thing I would say about that, Sally, is that I find that my son did this very thing. He was having trouble sleeping, so he got Tylenol PM. Well, I said, "Do you having any pain?" "No, I don't have any pain." I said, "Then why are you taking Tylenol PM? Why don't you just take Benadryl?" Because if you don't need the Tylenol, that's hard on your liver. And so it's really pointless to take something you don't need, especially when it has some long-term problems with it. So just get the generic Benadryl if you want to use that for sleep, but I also don't recommend using that long-term either. So
Thank you.
yeah, you're welcome. Anybody else?
Do a lot of these, I see glycine is in bone broth.
Mhm.
What about niacinamide?
Well, that's just a nutrient. So
It's not in any
it
specific
is, but
food
I don't
source?
know what's high in niacin. I really, that's not something that's on the tip of my tongue. But you could certainly look up and see what foods are high in niacinamide. If you take a multivitamin, it may be in there.
In there?
Yeah.
Okay. So like if you take a B complex.
Should be in there. Yeah, the thing I'll mention about B complexes is some of those can cause some stimulation. So sometimes those are counterproductive. Because if you ever, yes, and bladder irritation. If you look at energy drinks, they often have some of the B vitamins, B6, B12, and they can cause stimulation if you take them too late in the day. So if you take a B complex and you're having trouble sleeping, move it to the morning and see if that's any better. So other questions?
Lucinda, this is Sally again. That raised one more question for me. If you're taking high blood pressure medications, are you better taking that in the evening as opposed to morning?
Like do you have which one? It kind of depends on what it is, I think.
Well, lisinopril and hydrochlorothiazide.
No, hydrochlorothiazide is a water pill. You'll be up all night using the bathroom. So I would make
Yeah.
sure that one's in the morning for sure. The lisinopril, most people take it in the morning because their blood pressure is higher during the day than it is when they're sleeping. So yeah, I would say those are better taken in the morning.
And what about pravastatin?
Pravastatin is one that does not have to be in the evening, I don't believe.
Okay.
And so you can pretty much take that one anywhere. And I don't know that that has any real effect on your sleep, at least in the short term. Sometimes though, I think decreasing your cholesterol does have some long-term effects on your sleep because we need cholesterol in the brain for it to function properly. So,
Okay, thank you.
yeah. Ashley, you had looked up some foods that were high in niacinamide. What were they?
It says meat, fish, milk, eggs, green vegetables, and cereals.
Did you guys hear that on Zoom? Sally, could you guys hear that? Kathy?
Yes, I did. Thank
Okay,
you.
good. I just want to make sure you guys could hear.
Yeah, it said meat, fish, milk, eggs, green vegetables, and cereals.
So it's pretty widespread.
Yeah. And then it said down here which vegetable has it, and it said potatoes, including sweet potatoes, butternut squash, okra, corn, peas, parsnip, winter squash, and pumpkins.
Okay.
That
Yeah, a
sounds
lot of the
familiar to
squash. You said that's nothing I've ever looked up. So you got more information than I do on that one.
you. So I just looked it up then when they asked. me.
Yeah.
Thank you. Yeah.
All right. Any other questions that either one of us can answer? Okay. Oh, did you have a question?
No, I just know that a lot of these herbs,
Uh-huh.
you can get some of those in teas,
Yes, you can.
which to me is a little, I don't know, less evasive.
It's a
type
little, it's
of-
probably less amount. There's
yes,
going to be less of it in the teas,
yes.
probably, yeah.
Yeah.
But they still can have an effect on, on some of the organs, liver, adrenals, some of that. So I would just caution about overdoing those teas. If you want to try something like the Sleepy Time tea, I think has a number of different herbs in it. Chamomile, and I'm not sure what else. Celestial Seasonings tea has, I think, several things in it. So yeah, you could try that. Just don't do 6 cups of it.
At one time.
Yeah, for sure. Okay, if anybody who's on Zoom wants the handout, please email me afterwards. And I apologize that I did not put my contact information at the end of this program. So hopefully you've got my last one that has my contact information, and Stephanie's is, well, I think y'all probably know how to get hold of her, right? Because she's here. So, okay, well, we have one more program scheduled, and we're going to talk about going more after that. And it's an introduction to healthy eating is the next one. And that's sort of the introduction to a 4-part series that we do on healthy proteins, healthy fats, healthy carbohydrates that we did before COVID.
September, I think.
Oh, was it
we did,
September?
Yeah.
Oh, yeah, we did. You're right. So I don't know. We'll see if we decide to redo that, or if we do something else. So stay tuned. But we do have one more, and it's on the healthy eating.
Yeah, I think it's May 6th. I think it's the
Yeah,
Friday.
first Friday. So, okay. Well, thank you, everybody on Zoom, for joining us.
Thank you.
So